Opening. Visual. A senior man or woman sitting on the edge of a bed, looking exhausted, rubbing their eyes with sunlight peeking through the window. Voice-over to narration. Do you ever wake up in the morning feeling completely drained, even after a full night's sleep? Not just tired, but truly exhausted. If this is happening to you regularly, don't ignore it. This may be more than just poor sleep or aging. It could be an early warning sign of something far more serious, possibly cancer. Cut 2. Visual of the person slowly walking to the bathroom, holding the wall for support. Unexplained fatigue is one of the most commonly overlooked symptoms when it comes to early cancer detection. Why? Because it's so easy to blame it on age, stress, or a busy life. But persistent morning fatigue that doesn't improve with rest is different. It's your body trying to tell you something. Cut 2. Graphics showing different types of cancer associated with fatigue: leukemia, colon cancer, stomach cancer, etc. In certain cancers, especially blood cancers like leukemia or lymphoma, your body is constantly fighting, at a cellular level, even while you sleep. This drains your energy reserves. Similarly, cancers affecting organs like the colon, liver, or kidneys can disrupt how your body processes nutrients, oxygen, and energy, leaving you feeling worn out, even before your day starts. Cut 2. Doctor speaking in a clinic or animated illustration of red blood cells and immune response. Your immune system works hard during the early stages of cancer, creating inflammation as it tries to fight the abnormal cells. That immune response itself can lead to extreme fatigue. It's not just feeling a little tired. It's a kind of tiredness that rest doesn't fix. Cut 2. Back to the senior person, now sitting with a cup of tea, looking concerned. If you or someone you love wakes up feeling this way day after day, without explanation, it's time to pay attention. Fatigue that's new, persistent, and doesn't go away with proper sleep could be a red flag. Especially for seniors, early detection is key to improving outcomes. Text on screen. Tip: keep a fatigue diary for 7 days. Note how long you sleep and how you feel each morning. Talk to your doctor. Blood tests, scans, and simple checkups can help rule out or identify the cause early. Remember, it's not about panicking. It's about being proactive. Closing shot: calm reassurance, smiling doctor talking to a patient. Your body whispers before it screams. Listen to it. Voice-over narration. We all cough from time to time. It's normal, especially after waking up. But if you're experiencing a cough every single morning, and it lingers for weeks, it's time to take it seriously. Cut 2. Calendar flipping through multiple days, showing the same person coughing each morning. A persistent morning. Cough can be more than just a leftover from a cold or seasonal allergies. It can be an early warning sign of something much more serious, including lung cancer, throat cancer, or even esophageal cancer. Cut 2. Internal animation of lungs showing irritation or abnormal cell growth. When cancer begins to develop in the lungs or airways, it can irritate the lining, leading to frequent coughing. This type of cough is often dry, doesn't go away, and may even get worse over time, especially in the early hours of the day. Cut 2. A senior looking at tissues with a drop of blood. Some people might even notice blood in their cough or experience shortness of breath. These are urgent signs that should never be ignored. Cut 2. Doctor consultation visual or friendly nurse taking notes. If you're over 60 and have been coughing every morning for more than 3 weeks, don't just assume it's aging, dust, or acid reflux. Get it checked. A chest, X-ray, CT scan, or even a simple breathing test can reveal what's really going on. Text on screen. See a doctor if your cough lasts over 3 weeks. Early detection saves lives. Lung cancer caught in its early stages has a much higher survival rate. but that can only happen if you take that cough seriously. Closing shot, a reassuring scene, doctor and patient smiling after a checkup. Your health is worth that one appointment. Don't ignore the signs your body is sending you. Opening visual. A senior waking up in the middle of the night, visibly sweating, clothes damp, checking the bedsheet with a confused and concerned expression. Voiceover / narration. Waking. Up in the middle of the night drenched in sweat, even when the room is cool or the fan is on. That's not just a bad dream or warm blanket. It could be something your body is trying to warn you about. Cut 2. Clock showing 3:90 a.m., senior wiping their face, changing their shirt. Severe or frequent night sweats can be a sign of several health issues, but one of the most serious and often overlooked is cancer. Blood cancers such as lymphoma and leukemia commonly present with night sweats in their early stages. Cut 2. Medical animation showing abnormal white blood cell activity and inflammation. Why does this happen? As cancer cells grow, especially in the blood and immune system, your body triggers an immune response. This response increases metabolism and body temperature during rest, causing intense sweating, even when you're not hot. Cut 2. A senior putting a towel on their pillow before sleeping, looking concerned. This isn't your usual light perspiration. We're talking about waking up soaked, having to change clothes or even bed sheets, sometimes more than once a night. Text on screen. Consistent night sweats, SAKU, time to get checked. Night sweats can also be connected to other cancers, infections, or even hormonal changes. But in seniors, especially those over 60, this symptom should never be ignored, especially when it's new, persistent, and unexplained. Cut 2. Doctor speaking to a patient. Gentle tone. Reassuring visuals. If you've been waking up drenched in sweat for more than a few nights, and it keeps happening, it's time to talk to your doctor. Simple blood tests or scans can help rule out serious causes. Closing shot. A senior finally sleeping peacefully after getting answers. Your body is your best communicator. Listen when it speaks, especially in the quiet hours of the night. Have you noticed your clothes feeling looser without trying to lose weight? If you're shedding pounds without changing your diet or activity, it could be a sign of something more serious. Cut 2. A digital scale showing decreasing numbers over several days. Unexplained weight loss is one of the earliest signs of cancer. Cancers of the stomach, pancreas, lungs, or esophagus can speed up your metabolism or reduce your appetite, causing weight to drop quickly and without reason. Cut 2. Senior picking at food, looking uninterested in eating. Many seniors dismiss this as just getting older, but losing more than 5% of your body weight in a short time, without trying, is a red flag that needs medical attention. Text on screen. Lost 10 plus lbs without trying? Talk to your doctor. Weight loss caused by cancer often comes with fatigue, loss of appetite, or changes in digestion. These are your body's early warning signs. Cut 2. A concerned senior talking to their doctor. If you've been losing weight without trying, don't wait. Early testing can help detect issues before they become life-threatening. Closing shot. Senior smiling after getting a diagnosis and treatment plan. Unexpected weight loss is not normal. It's your body's way of asking for help. Listen to it. Waking up with aches and stiffness might seem like a normal part of aging. But what if that pain feels deeper, stronger, or just doesn't go away, even after moving around? Cut 2. The same person slowly walking toward the bathroom, holding their hip or lower back. Persistent pain or stiffness in the morning can sometimes be an early warning sign of certain types of cancer, especially bone cancer, or cancers that have spread to the bones, such as prostate, breast, or lung cancer. Cut 2. Medical animation showing bone marrow or cancer cells affecting joints. Cancer can trigger inflammation or weaken the bones, causing pain that's often most noticeable in the morning after lying still all night. This pain may not improve with gentle movement like typical stiffness from arthritis does. Cut 2. A person stretching with visible discomfort, shaking their head. You might feel sharp pain in the back, pelvis, or limbs, pain that seems out of proportion for your activity level or age, or stiffness that lasts more than 30 minutes after waking. Text on screen. Morning pain that's new, severe, or constant. Check with a doctor. Many seniors assume this discomfort is normal, but when pain is new, persistent, or progressively getting worse, it's a sign you shouldn't ignore. Cut 2. Seniors speaking with a healthcare provider, getting scans or blood tests. Early detection is key. A simple blood test, X-ray, or MRI can help determine if your pain is due to wear and tear or something more serious. Closing. Shot. The senior looking relieved and comfortable after receiving care. Morning pain shouldn't define your day or your health. Listen to your body. The sooner you act, the better your chances of a full recovery.